Hi, so welcome everyone. Thanks for joining us and taking time out of a quite full SF Climate Week to join us today um, for a talk on healthier communities through clean energy solutions. So my name is Dr. Jessie Liu. I'm a family medicine physician at La Clínica de la Raza here in Oakland, California. I spent my childhood growing up in the woods of Indiana, then the oceans of Southern California. Went to college thinking I was going to become a marine biologist, and then took a long detour involving doing water and sanitation work in the Galapagos and co-founding an organization called NeuroHealth before going to medicine, becoming a physician, and then now at my role in La Clinica, I get to work both at the end of how nature can be healing for our patients, as well as the ways in which nature can be harmful with the changes in climate.
Hi, everybody. My name is Keegan Bowers. I am a pediatric physician here in the East Bay. I'm technically a fifth-year pediatric resident at the Kaiser Permanente Pediatric Residency Program here in Oakland. I am also getting my master's in public health at UC Berkeley School of Public Health. I'm about to graduate in that, focusing on environmental health policy and advocacy. I've been an advocate for children, pediatric patients for last several years with the American Academy of Pediatrics and the California Medical Association, and have always been really interested in environmental health and have used my master's as an opportunity to kind of get more experience in that. And I'm very excited to get to talk to you guys about, how you can get involved.
And since we're talking about stewardship of our planet and also we'll be focusing on some of the things that we can do locally here in the Bay Area, I wanted to start with a land acknowledgement, which is adapted from the UC Berkeley Native American Student Development Association, co-created with the Muwekma Ohlone tribe. And we recognize that we're on this territory of Huichin, the ancestral and unceded land of the Chochenyo-speaking Ohlone people. The land was and continues to be of great importance to the Muwekma Ohlone tribe and other familial descendants of the Borbona band. And we recognize that I and every member of the Bay Area community has benefited and continues to benefit from the use and occupation of this land. It's important that we recognize the history on which we stand, and also that the Ohlone people are alive and flourishing members of the East Bay and broader Bay Area communities today. So for this next hour or so, we'll first start with introductions, then talk about how climate change is impacting human health, speak a little bit about where we are in these pretty critical political times, then move on to talk about what the health benefits might be of clean energy, and end with advocacy action. I hope today that you'll get out of this talk something around learning how climate change and human health are linked, as well as certain things that you can do with regard to advocacy. And enough about, well, we'd love to get a sense of who's all in the room. So please put into this chat your name, pronouns if you'd like, any relationship to the health community, peripherally or integrally, where you're coming from, and why are you with us today? Thanks for being here, Yolanda. Let's see who else may have access to keyboard capabilities. Raj from Western Kentucky. Wow. Ryan Johnson, Troy Cotton, Atlanta, Georgia. So it sounds like we have some people who are here from all over. Nancy in Pacifica. Shannon, thanks for coming in. Solar engineers, people on electricity access and affordability, food, social justice, environmental economists, city council member. Kalb, Dan Kalb. Thank you for joining. And Emma working in nonprofit. So it looks like we have public, private, and nonprofit. So thank you all for continuing. And this is really exciting to have such a diverse group of people here. Right. And looks like we have perhaps a couple of people who are public health or in clinical medicine as well. So thank you all. So Climate Health Now, which is an organization both Keegan and I are part of, is a 501c3 nonprofit and 501c4 action fund with close to 1,000 health community members, broadly defined people who are in clinical service care, but community healing, health sector administration, health research, development of pharmaceuticals or products, with a mission to organize and activate the California health community to advocate for equitable systems level climate action. And why do I care? Because what's bad for the plant is also bad for my patients. And just last summer in urgent care, I saw a 10-year-old boy whose family had moved from Oakland to Richmond. For those not in the Bay Area, that's about 10, 12 miles or so away. His asthma had been really well controlled prior, and then pretty soon after moving, he started having multiple asthma exacerbations every single week. His parents had heard that the air AQI was worse up in Richmond due to the Chevron refinery proximity there, but they just didn't know how bad it would be. Next slide. Lots of research shows that living near oil refineries increases the risks of asthma, exacerbations from asthma, COPD, or other pulmonary illnesses, in addition to increasing the risk of cancers such as leukemia, lymphoma, lung cancers, brain cancers, as well as other respiratory issues, as well as cardiovascular things. Pregnant patients have increased risks of preterm births, as well as low birth weight. And then people with heart disease, history of strokes or heart attacks, as well as people with older or younger age and have really small vessels in their lungs or tubules in their lungs or vessels in their blood are at greater risks for complications and morbidity and mortality as well, due to primarily PMs 2.5s. It was estimated in 2022 that the Chevron Richmond refinery emitted about 60,000 pounds of hazardous waste each day. In 2023, 25,000 pounds. Those were two separate sources that I was looking at, so might be accounting for some of the differences, but those are just merely estimates. Next slide. So this is a bit of a complicated chart that I could spend a lot of time talking about, but I want to bring attention first to the inner circle, in which refineries are just one example of ways in which a lot of factors that are causing the increase in greenhouse gas levels are contributing to worsening health impacts. So increased GHG levels certainly causing more extreme weather, rising sea levels, rising temperatures, and then now expanding out. There's all of these impacts that have both individual as well as more societal and community level, systemic level impacts. Just a few examples are listed here. And I can list them off of extreme heat and air pollution, drought, environmental degradation, wildfires, and smoke. There are multiplier effects, layered impacts. We know, for example, extreme heat leads to worse air pollution. Heat can lead to drought as well as worsening wildfires and smoke. All of that can lead to environmental degradation, resulting in forced migration, civil conflicts. And then on the other side of this chart, looking at severe weather in the form of floods, which can certainly cause increased algal blooms. It can just make society stop and really affect the way that we are able to respond as a health system to just even routine health concerns and visits, in addition to what is exacerbated when there is a climate emergency. Just to bring attention to that, I think for people in the room, well aware that climate change is affecting food systems as well as exacerbating social inequities, which I'll speak more about on the next slide. So telescoping out to the societal level, climate change is now a social determinant of health. And that's public health speak for saying that there are certain factors in society, such as housing, food, income level, education, that can amplify existing vulnerabilities for people everywhere. And those can have very real health outcomes. As with many forms of harm, the people who have the fewest resources are the most heavily impacted. And there's a lot of intersectional factors of demographics, geographic, where they live, socio-political conditions, socioeconomic, race, and certainly intersecting with biological factors, things that we're learning more and more about with genetic epigenetics and the impacts of generational stress or long-term stress on individuals or across communities. And if we think about who is more at risk during, let's just take high extreme heat days for an example. It's people who are working outdoors, gardeners, construction workers, people who are working in hot environments, as kitchen staff. And although there are legal requirements for employers to be providing certain services such as cooling, certain number of breaks, water stations when the temperature is above a certain level. I think it's 95 or 85 for indoor out. Don't quote me, but there it's unsure just how much teeth there is behind these work restrictions that California has put in place. And each state has its own, if there are existing any requirements. So this is an example in which people who have less agency may be experiencing greater health risks. I see patients all the time who come in with lab abnormalities or have breakthroughs in seizures, worsened migraines due to exacerbations during high heat or poor air quality. And there's speaking now moving more toward the health system capacity and resilience little area here, which intersects with the ways in which health outcomes present. Any climate event really strains already strained existing systems and resources. When there's power outages, everything comes to a standstill. For example, I just spoke with a colleague who was talking about during floods, they weren't able to even come into work. People aren't able to get their medications. In our clinic, even when it's just hot, we don't have AC, so we don't open up the refrigerators to provide vaccines or insulin for patients who are having really hyperglycemic episodes. Anyway, the list can go on and on, but I digress, and let's move on to the next slide. So would love for each of you to put into the chat now, what is one way that you have seen or can imagine seeing climate change affecting health in your community? Stress. Yeah, the emotional stress is huge.
Stress is a big one.
Yeah, I think
worse
allergies, flooding, heat waves with no AC. The ticks and mosquitoes, the vectors, that was something I hadn't called out. Asthma, yes, heat strokes. It's fascinating that with heat, the majority of morbidity and mortality are actually not directly from heat strokes, but from increases in existing conditions. Tenants in unaffordable housing units with higher health risks, economic challenges. Student athletes, definitely anyone who's doing anything with exertion outdoors. Um, and I think that one thing that I hadn't mentioned that had forgotten to, but is extremely, extremely important is, of course, the mental health impacts of climate um, in the immediate as well as the long term, the climate anxiety as well as how it's affecting people in the immediate term. I have actually had a patient who required hospitalization due to such severe anxiety that they were unable to be functioning and were, yeah. So just really heavy things, wildfire smoke, um, things that we know that are already systemically making it difficult for people to achieve good health outcomes. Climate is making worse. All right, let's go on to the next slide since we've talked about a lot of doom and gloom. And we're currently in an economic system that requires infinite growth on a very finite planet. And we all know here that we need to switch. It is imperative that we switch to renewable energy sources and reduce the per capita consumption. Greenhouse gases are this root cause of of climate of our climate emergency, and it is really important that we be doing this. It's important for the health community to be speaking up and out about switching to renewable energy sources in order to not only be meeting our global climate goals, but for human health. And we're living a very pivotal moment in history right now, in which unfortunately there is declining democracy. 2009, many of you may already be aware of this, but Congress passed the endangerment finding that established that greenhouse gases threaten public health and welfare. Unfortunately, in February of just 2026, the EPA repealed the endangerment finding, which removes the legal foundation for virtually all federal climate regulations. That includes vehicle emission standards, power plant limits, and has really crippled the US government's primary legal mechanism for being able to fight climate change. The administration also dismantled the EPA as well as scrubbed clean terms like climate change, environmental justice. They've halted federal efforts to be addressing pollution disparities in marginalized communities and integrating that into any public health considerations. And even more aware, I'm sure each of you who are working in anything clean energy are know that there's just been a complete freezing of funding and permitting for clean energy initiatives. And here we are. Studies do show that the best way of fighting climate anxiety is by working in groups with collective efforts on systemic change. And the Climate Health Now is creating a movement in which it is the norm, not the exception, for members of the California healthcare community to be bringing our trusted voices to the policy table, decision-making table, to be protecting health as well as promoting health equity. Climate Health Now did participate in coalition work to be bringing about this historic settlement in which Chevron is agreeing to pay $550 million to the city of Richmond for primarily social services over 10 years. And that was Chevron's choice. Instead of paying a 50-year refinery tax, that was the Polluters Pay Initiative. And I think that maybe others can know more about it, but that is my understanding in which how that settlement came about. Climate Health Now participants also go to Sacramento, speak with local and municipal governments, county level, state level, to be advocating for certain climate related bills that will have positive impacts on human health.
Great. Thanks, Jessie. So we're doing well on time. I'd love to hear any thoughts from anyone in the chat, how they think clean energy could benefit health and address environmental injustice. I'm going to go over in just a minute how Climate Health Now frames some examples of environmental issues through a health injustice lens to promote some environmental solutions. But I'd love to hear, if anyone has an idea kind of right off the top of the bat. I know we have some public health people here and some other kind of advocates. Perfect. Yep. Yep. Reducing combustion fossil fuels, less particulate matter pollution, exactly, less respiratory disease. That's a big one. Great. Perfect. Access to cooling and heating for pregnant people. Excellent. Cleaner air and water for all. Absolutely. Great. Perfect. And if there's not lower costs, I'll say so. And if there's not a ton of answers, that's excellent. That means I actually have something I can teach some people. Oh, great. Less harmful air. Yes. Better environment, access clean air. I like the clean air is coming up a lot. We're going to talk about that too. Reduce disparities. I am so glad somebody mentioned that. That's a big one. I feel like that often gets overlooked, and we're going to talk about that too. Excellent. And cooler cities. Cooler is in temperature, I assume, not just, cooler places to live, but both. Both are true when you deal with environmental issues. Great. That's healthy people to living in certain areas. Interesting. And not near fossil fuels. Yeah, yeah, absolutely. Perfect. Okay. We can move on to the next one. We'll talk about that. These are all great examples, and a lot of the stuff we're going to talk about. Cheaper running EV cars. Great. All right. So for one example, an immediate health benefit is kind of talking about clean and renewable electricity. So as some people have already mentioned, when we switch away from our current predominantly fossil fuel based energy production and switch to things like solar, wind, and geothermal, this helps rapidly reduce air and water pollution. And like some people have already mentioned, this directly decreases things like illness and human harm. We're going to see a little bit of numbers about early and premature death reduction because of decreases in air pollution. And then another way to kind of translate this for policymakers or for the public is to talk about things like decreased healthcare costs. Next slide, please. Perfect. To translate this into some health data that we can kind of talk about as health advocates, one example would be globally, if governments were to speed up their timetable for reducing fossil fuel emissions, according to a 2018 Duke University study, as many as 153 million premature deaths could be avoided. And then kind of looking nationally, according to the Harvard School of Public Health, the Biden administration's 2020 goal in the Inflation Reduction Act of getting 80% carbon-free power by 2030 would have, if it had been implemented in its totality, have saved an estimated of over 300,000 lives through the reduction of air pollution. A lot of this would have been in the southern states, but overall it was projected to kind of decrease the, oh yeah, broken heart, I agree. Overall, it was projected to decrease the air pollution of some of these, harmful chemicals that you can see here: mercury, nitric oxide, particulate matter, nationwide. And so when we're talking about these health issues, putting it in terms of lives saved, premature deaths averted is a really impactful way to translate some of these changes. Next slide, please. Perfect. Another example would be climate smart buildings and homes. Commercial buildings and homes contribute about 13% of the greenhouse gas emissions in the United States. So adopting energy efficient practices for these applications helps reduce the additional need of these fossil fuels that we've been talking about. So not only does this translate to all the benefits we've already previously discussed, but when you replace gas appliances, things like gas stoves, gas water heaters, dryers, those kind of things with alternatives, you eliminate not only that universal outdoor air pollution and the contribution from fossil fuels, but also harmful indoor air pollution, things like the nitric oxide, benzene, methanes. These are pollutants that I think we've mentioned a little bit before can cause things like allergy symptoms, increased rates of asthma, especially in children, as well as increased susceptibility to respiratory infections and a lot of other things. An example of policies that can help facilitate this transition are things like local rebates from energy providers. Slides will be recorded and distributed later. Local rebates from energy providers, Bay Area cities offer rebates, and there's also state rebates. So kind of ways to financially supplement these transitions for people. In the peninsula and the South Bay, there is 0% financing programs that are offered by Silicon Valley Clean Energy and Peninsula Clean Energy that have the potential to scale some of these public funds to reach general populations. So these are some of the policies that we could be advocating for, and then I'll show you some of the data that we use. Great. So one way to talk about this is that we spend 87% of our time indoors. Using some of the affordable policies that I've mentioned, buildings can be designed, built, or even retrofitted with climate smart interventions, things like proper insulation, using modern HVAC equipments, prioritizing natural light over artificial light sources, transitioning from gas stoves to induction stoves, or things like heat pumps. This helps reduce the fuel that we use indoors for heating and cooking, air conditioning, refrigeration, and helps reduce waste. So by improving, more in the comments, so by improving this indoor air quality, one way to translate this into kind of an advocacy health lens is by talking about the amount of money that is saved not only for the general person, but kind of as a statewide as well. So by improving this indoor air quality, you would potentially save $6 to $14 billion from reduction in respiratory disease. This is also $1 to $4 billion from reduced allergies and asthmatic symptoms. And then in a more vague sense, but still very real, you could save anywhere from $10 to $30 billion from reduced syndromes associated with discomfort and acute health effects, something called sick building syndrome. So these are kind of monetary values that you can place on the benefits of clean energy and greener energy that can really help persuade people if, for example, maybe saying, premature deaths wasn't enough. These are alternative ways you can use this information to help advocate for change. And I have one more example for you. A third one would be clean and active transportation. So these are policy reforms that reduce things like vehicle emissions, the number of vehicles on the road, or decrease the length and frequency of trips. And you might put that in the context of something called an indirect air source. So not necessarily people that are driving cars themselves, but places like warehouses or ports, places where lots of vehicles or shipping containers, large scale construction equipment are being used, which with policies can help decrease the amount of trips or the lengths of trips that these places use. And an example of policy changes that are kind of moving towards this clean and active transportation here in California would be Governor Newsom in 2020 signed an executive order that directed the state towards a 100% new zero emission vehicle sales by 2035. And in 2022, CARB adopted, that's the California Air Resource Board, adopted the Advanced Clean Cars 2 regulations, which are trying to help reach that goal by ramping up, starting with models in the year 2026. There's been some federal pushback on this, like we talked about. We're in a bit of a contentious period when it comes to environmental policy, but that's an example of some of the policies we can advocate for. And so this gives us a good chance to look at things like equitability and injustice when it comes to air pollution and environmental issues. So systemically racist policies and practices have deprived some communities equal access to things like public transportation. You can look at the map on the right and just keep a mental image of that going forward. That'll kind of come into more context later. But also the availability of things like vehicles due to discriminatory lending practices, as well as unequal pollution exposure due to housing discrimination. And so this is important. You could say, as for me, a physician, when you're telling somebody, it might be better for your health if you were to, get outside, walk or run, bike, maybe take the opportunity to, get some physical activity while you're going to the store, to school, to work. This might not be possible for everybody because of unsafe traffic near the area, unequal access to green spaces, bike lanes, sidewalks, and so policies that increase these access to places like parks or biking lanes, sidewalks, allows for increased physical activity as well as decreased air pollution. Next one, great. And so this is hopefully at this point, most people are familiar with the term gerrymandering or redlining and some of its severely negative impacts on communities of color and underprivileged populations. So this is, I just want to make sure we are talking about air pollution as an environmental justice issue in the Bay Area. So if you remember that prior map that was mapping out some of the public transportation available in the Bay Area, a lot of these areas that were redlined and considered higher risk home loan areas are also areas with lower amounts of public transportation. So these are historical and even more recent ramifications of redlining that result in, as you can see on the chart on your right, direct impacts of air pollution and lack of access to some of these things that we talked about. So, for example, you can see that the asthma-related ER visits are higher in these, high-risk areas. And just to put a number on it, the residents who live in the Bay Area in the areas marked as hazardous are 2.4 times as likely to visit the emergency room for asthma-related issues compared to peers in other areas. So this is another way you can frame these environmental issues. A lot of politicians and regulatory makers do care a lot about communities of color or lower income communities. And so when you put the context in that these are the people that are the most impacted, it can really resonate with a lot of them. And it makes sure that when we talk about those things, that you are putting the focus on them and making sure that they are addressed when it comes to addressing things with policy. And just to kind of wrap up this talk with a couple more data points on clean and active transportation benefits. There have been studies that show by providing more ways to get around, you can increase the overall health of the population by decreasing things like the rates of obesity and then physical activity or physical inactivity. And then for our example here, our local example of the BART system, that is carrying roughly 150 to 200,000 riders a day. And this is an equivalent to taking tens of thousands of cars off the road. So help reducing air pollution and also, encouraging physical activity. And I don't know if anyone is aware, they are, the BART is undergoing funding issues currently. So if you see anybody with a petition out in front of BART, just give them a talk and see if you are interested in signing that petition and maybe keeping this available and helping, reduce some of our carbon footprint here. Going forward, great. And then to introduce a fairly recent concept, something called just transition, making sure that when we're talking about this transition to renewable energy and clean energy sources, that we are talking about how we make that transition and making sure that we're not creating new inequities as we do so. So to meet climate goals, we need to ensure that the whole of society, all communities, all workers, all social groups are brought along in that pivot. And the International Labor Organization defines a just transition as greening the economy in a way that is as fair and as inclusive as possible to everyone concerned, creating decent work opportunities and leaving no one behind. The Asian Pacific Environmental Network defines it as a vision and framework for moving towards a world where everyone has the resources they need to live full, dignified lives. So some of the projects, some of the examples of these are projects that are growing locally produced and governed 100% clean renewable energy resources in the neighborhoods that need it most. poor and working class communities of color that have been at the front lines of fighting big polluters. So just always keeping that in mind. And one more, maybe more tangible example is, as we transition away from these fossil fuels, it's important to consider the workers and the communities who depend on those fossil fuel industries for their jobs and their incomes, and making sure that we're not creating vacuums of inequity as we move away from those. Um, yeah. Great. And then just a little bit of an overall, some things to consider. Like we talked about, the global energy demand is going to continue to rise. Whether we make these changes or not, the demands are going to go up for numerous reasons. And it's important, like I mentioned, that clean energy is still going to require resources. Extraction of minerals, land use, water use, and we want to make sure as we're moving towards those, we're not creating new environmental justice concerns by putting burdens on communities, usually underprivileged communities. And it's always important to remember, a high consumption lifestyle. The top 10% of global income earners are responsible for 50% of emissions. So people who are, tend to be wealthier, have a bit more of an impact. And it can't really be understated, the changes that we make as individuals, but definitely the changes need to come from a larger community setting and a larger state setting. So as we move forward, it's always helpful to do your part, but one of the things that needs to change is how the system works, and that's where the advocacy really comes in. Great. And so again, we talked a little bit about some examples. There are so many more, and of course, the health data is infinite. But I'd love to know, what excites you about these solutions that we've mentioned so far. Are there other solutions that you're excited about? And what does a healthy and just Bay Area look like to you? And I'll look and see what the comments are saying too while we're doing that.
Or if others are not from the Bay Area, since it seems like there are a lot of people across the country, what does a healthy and just community wherever you live, what might that look like for you?
Transition, convenient, frequent, and electrified. Great. Learning how hospital community benefit programs could invest in indoor air quality. Another great one. Having actionable data. Environmental justice mapping tool. Interesting. I know we have some environmental justice mapping tools, maybe not as detailed as this New York City one. Green spaces, access to public transportation, safe biking, green spaces. Everyone would benefit from, yep, everyone would benefit from funding underserved communities, absolutely. Able to be outside when you want, clean water. Neat. Yeah, the Calenviro screen. That's what I was thinking of. Thanks for that, Whitney. Installation heat pumps. Perfect. Okay. So I guess the next part of this is we'll talk a little bit about how you can advocate for some of these things that you're talking about. First of all, when it comes to environmental issues, it's very easy to kind of get lost in the weeds. Research has demonstrated that framing something like climate change as a health issue can help increase support for collective action. And some of the reasons for these could be things like framing issues as a health problem is bipartisan. It impacts people across the entire political spectrum, and perhaps the biggest hypothesized advantage is that people generally seem to tend to care about their own health, if not the health of their loved ones, or in some cases, their constituents. And then rather than speaking about these, climate change in terms of uncertain future events and kind of as an abstract or global concept, this health framing really brings the climate change close to home by making it local, short-term, and personal. Um, I'd also say that presenting climate change as a health issue is promising because it engages audiences and also motivates collective climate action, especially among groups that might be less concerned. Like I said, it's really something that everybody can kind of identify with. And people have been shown to respond more positively to information about health benefits when it comes to mitigation actions, whereas they might not be as motivated by something like, oh, a temperature degree change, or, how much was that air pollution going down? If you frame it in terms of some of the things we talked about, it can help make policy solutions more compelling. And then an interesting study in the BMC Public Health found that framing climate change in public health terms provides a youthful and engaging new frame of reference that can increase personal relevance and engagement with an issue. And what we're going to talk about next is, like I said, how to use these to advocate for the changes we want to see. So advocacy, I couldn't come up with a better slide than just putting up the definition. But basically, it is anytime you are, supporting a cause or a proposal. And in our particular case, we're talking about, climate solutions. And so what does that look like? One of the ways that you can, advocate for the solutions that you'd like to see are things like general government communications. And when those are things like public comments. So for those of you who, maybe are less familiar with public health or the governmental regulation system, a public comment is a structured overview of feedback that is submitted by the public during a formal comment period on a proposed policy, rule, or project. So government entities are required to create public comment periods where anybody can submit a comment. And anyone who submits or any comment that is submitted has to be addressed by that regulatory body when making their final ruling. One of the things you can think about with this is that volume is important. So making a lot of people producing the same public comment can really show that there's an investment in this particular concern. But the core of a public comment is its content. The content should be poignant, it should be direct, and it should really show the weaknesses or strengths of whatever proposal you're trying to support or oppose. And one of the things to kind of carry with you is, let's say, and you can make that as an individual. We at Climate Health Now kind of organize and make public comments as a group, but anybody can do it. And one of the things to think about is, let's say, you don't feel like your comment was necessarily addressed sufficiently. One of the great parts about public comments is they can be used as a legal basis for a legal argument in the future. If that comment was not addressed sufficiently, a lawsuit can kind of happen retroactively to address that. So even if it's not happening live, it's currently going on with a lot of the Trump administration changes. A lot of that stuff will happen later on. So it is worth it to do public comments. Testimony is another way you can get your voice out there. During a lot of these legislative procedures, they will have hearings where they will invite the public in. You can see here on the right, we've got a couple of our Climate Health Now members at some of these hearings. And these are great times to share some of this health data that we're talking about. It's easy to get lost in a lot of the numbers, but when you talk about things like human lives or personal stories, they're very impactful, and legislators that are invested can use those stories going forward to kind of further their arguments. And then if anybody's a physician, patient care stories, there is a saying in public health that numerous deaths or numerous people involved is a statistic. One person or one story is compelling. It's more impactful. So making sure that you really don't underestimate how powerful one story is. Another one is petitions. You've definitely seen petitions or heard of petitions. These are a great way for the public to generate their own regulations or legislation, but also to demonstrate public interest in something. So again, Climate Health Now helps organize some of those things, but you can find petitions on lots of things that you're interested in. And here's some examples, or some examples of Climate Health Now active advocacy recently was, we've submitted public comments on air districting rules, as well as pushing back on the Bureau of Management's attempts to lease over 1 million acres of California public land to new oil and drilling. And those have to be addressed before they move on with those. Another way, which is a little more flashy in some cases, but also a little more diligent in others, is public communications. The power of the public opinion and public interest to create legislative change cannot be understated. It is a huge driver for policy. So doing things like making speeches during media or press conference events, you can see Climate Health Now doing one of those there, and that kind of big picture are impactful, and they're very visually drawing, but also things like letters to the editor, where you're responding to articles in newspapers, journals, and kind of talking about your health talking points can also be impactful, as well as op-eds, where you can submit really anything that you're interested in, as long as it's timely and relevant to whatever newspaper you want to submit those to. You can bring up your own topics, like Ashley McClure here has done in our Cal Matters Protecting California Public Lands from Oil and Gas Drilling. You can tell that's what we've been working on recently. But these are great ways to get more public eyes on your issue and to spread awareness. So like I said, here's our some recent examples of us having doing some speeches, writing op-eds and letters to the editor. Great. And then there's also the option to meet with your electeds, in person and talk with them directly, which is one of my favorite things to do. We have lots of examples here of Climate Health Now members meeting with California representatives about that BLM land management thing. That's some of the virtual ones. But that doesn't have to be just statewide issues. You can talk with your local legislator, or go as big as nationally. This is some pictures of us at the Washington Capitol, where we talked about some of the EPA regulations around no longer considering the health benefits of reducing air pollution. And what that does is it not only shows your representatives that you're invested and you're interested, but it also gives you the opportunity to see what their priorities are, and kind of help respond to that. You can create a dialogue with them. And that's one of the things I think joining an organization like Climate Health Now helps with, is these long-term relationships where you get to kind of develop collaborations with legislators that make these policies happen. So one of my favorite things to do, but individuals can do it too. So don't feel like you have to, join a group to do this. You can write letters or schedule these meetings yourself. But I will say there is so much benefit to joining a community. I believe that all advocacy should come from the community itself, and that's what Climate Health Now is. It is a local community-based organization, and there is definitely a benefit to being a part of an organization like this and being a part of your community. These are certainly tough times when it comes to environmental issues. We are fighting an uphill battle, and it can be exhausting and tiring, but having people around you that are on the same boat and are motivated to do the same change, to make changes, and you get to celebrate the wins together and endure the losses as you make progress, definitely helps a lot. And so just to plug a little bit more for Climate Health Now, you've got us here at the bottom left with our Climate Solutions Potluck. In the bottom right, we're doing a National Sunday get together, and then in the upper right, a little bit of a Make Polluters Pay advocacy event. So I would definitely recommend joining some form of community, if not ours. Great, and I think I'm doing okay on time. So we'll talk a little bit about taking some action while we're here. So one thing that is currently happening at the moment is the air district application rules around furnace and water heaters are currently being debated, regulated. And so one of the facts we wanted to kind of preface this off with was that gas appliances in the Bay Area, homes and buildings produce more smog-forming pollution than all of the region's passenger cars combined, which drives some of the worst air quality in the nation. If you didn't know, California has several cities that are listed as some of the top worst air quality cities in the United States, according to the American Lung Association. So anything we can do for that is a plus. Going forward. So there are two amendments to air district rules that we are hoping to support, or hoping you will support. Both of these are related to nitrogen oxides that are released from in Regulation 9 Rule 4, residential type central furnaces, and then in Regulation 9 Rule 6, natural gas-fired boilers and water heaters. These would only apply to new appliances and not necessarily any retrofitting with these regulations. So this rule change would affect roughly 2/3 of households currently, going forward as they replace those appliances, and will improve overall regional air quality from outdoor venting of these appliances. And to put it into some of these health impact terms, we're talking about things like nitric oxide, which causes coughing, wheezing, difficulty breathing, increases rates of asthma, as well as increased susceptibility to respiratory infections, as well as that particulate matter 2.5. That's the tiny stuff that gets in your lungs and causes things like asthma, as well as inflammation that can lead to neurological diseases, heart attacks, strokes, lung cancer, and premature death. So our goal is to decrease those in our air. And this new rule will prevent about 1,500 asthma attacks, prevent 85 premature deaths every single year, and even help save families money as much as $370 on annual energy bills. So this, as we kind of talked about, and from an environmental justice perspective, helps deliver clean air to the communities that need it the most. And as an example of some of the things I talked about that you can do, we have a petition. This is from the Sierra Club, a petition that you can sign right now if you'd like. There's a QR code there. And then you also have a meeting on May 6th, another hearing that you might be able to talk to the Air District Board directly and kind of maybe voice your support or concerns about these regulations, a chance to get your voice out there. So there's a QR code to RSVP there. And like I mentioned, these will be sent out later. So if you didn't get a chance to read those now, you will have time when we forward the recording. I think that's you, Jessie.
I thought I was not on, I was muted. So this is an opportunity later on, and it would not be quite as immediate of an action, but this would be more of an investment in your own skills, building upon whatever skills you already have for using strategic storytelling to be advocating for health. This is yet another QR code to be signing up to participate in this weekly workshop of public narrative training based on Marshall Ganz's story of self, story of others, and then kind of moving on toward how are we wanting to include others in building movements and helping to talk about more compellingly than I am speaking right now of why we should be advocating for health and climate. And more QR codes, but please follow us on social media if you are at all interested in learning about what health policies our policy team is deciding to put more focus on, events, any other postings that we post about that have to do with climate and health. If you'd like to, or if you'd just like to continue to be in touch, feel free to scan the QR code of the social media platform of your choice. And we'd also love to hear from you. So please, if you have a minute or two, please share any feedback that you have on this presentation for us to be able to improve on again. I think Talitha was asking for a link, but the recordings will be sent out. And I think that Whitney has put the other links to different QR codes that were previously in the chat. Thank you, Whitney. And so thank you very much. We'll conclude by providing this opportunity for you to be joining us. If you identify as a health community member, broadly speaking, sign up for CHN or with this QR code here.
Yeah, thank you all so much for joining us. Even just being here and being interested is a huge step. So I really appreciate your time and interest.
Yeah, and I've thoroughly enjoyed the chat and the resources that people have provided, the thoughtful questions, the input. Clearly looks like everyone is doing some remarkable work in their respective communities. So thank you for taking the time to be joining us, sharing out, and hopefully learning a few things yourself.